Tammy. There's a difference between the two, because postpartum blues, as we said, is a common thing that occurs, and usually it's just a dysphoria that most women would get post-delivery, and almost about 75% of women will get that from the second week after delivery, and it should wane off before the end of the third week. It's when it becomes prolonged beyond 4 weeks, and then it starts getting into a minor depression or a major depression, where it becomes concerning, because suddenly now the general symptoms of depression, like a person feeling unwell, a person feeling that they are worthless, and some people actually having propensity to harm the baby and even to commit suicide because of the overwhelmingness of what they've just had. Because bringing a baby onto earth is a very difficult thing, in that the anticipations of what it is before it comes out and what it really is when it's outside. I mean, I usually say that it's a very interesting teddy bear that before it comes out, it doesn't need food, and the day it comes out, it needs food. It doesn't know what time it is. It cries anytime. And a mother who's got no support around her gets overwhelmed drastically, and that generally would lead to a lot of women going into depression.
So how, doctor, do you then know whether it's the blues that you have, something that will wane in a period of a couple of weeks, or if it's depression?
It's generally the intensity of it. I mean, if you generally wake up in the morning, you feel a bit unwell, and then you shake it off and you get better, then that's fine. But for the majority of women, those who have a propensity to depression, and suddenly that goes into where they start talking down on themselves, they start feeling as if they're worthless, those ones are the ones that to watch over. The problem is that the person who has the problem doesn't recognize it. It's the people around them who would recognize it. And because generally depression or mental illness in general, people shun upon it because it's stigmatized. She may be seen not to be a strong woman, she's not strong enough to go through a labor. And so what then happens is that they tend to hide what they are feeling, and they basically cry on their own. The baby themselves, remember, the baby doesn't talk, doesn't say anything, so the new mother has to work out whether now it needs food, now the nappy must be changed, and now the baby must play. And then sleeping patterns also, those sleeping patterns that change, the mother has to adapt to the baby's sleeping patterns, because if she doesn't, then she will forever be tired, and that lack of sleep on its own can push them into a depression.
So how does the family or those who are around the mom at this particular time, how do they best support them?
I think, in an African context, Tammy, we have a concept whereby when a child is born in a family, women go there to support the mother, and they keep the mother indoors for at least 3 months most of the time. And what they're doing there is making sure that it's trusted people that the mother knows. They continuously are looking after the baby, and what she's able to get out of it, she's able to get rest, she's able to get food, and without anybody else around her, those things are not there. A frustrating thing, a simple thing like learning how to breastfeed can frustrate her to an extent that she feels worthless. And so in the presence of people around just calms the person. The presence of the partner, the person whose pregnancy is responsible, is probably the most important person, because the woman generally would want to feel that the person who I'm with this together is actually there helping me. But during this time after delivery, they need practical help. Practical help meaning, I need to sleep now. Is there somebody that I can trust who can look after the baby?
But
people around and their friends.
Is that then not the major problem, specifically during this time, where you can't really have family coming through, you can't really have a lot of friends coming through because of COVID-19? I guess, yes, it is against the lockdown regulations, but you also want to safeguard your newborn.
Yes, and that's the challenge now with this pandemic, and the fact that, one, you can't have people coming around, but number two, you want to protect the baby from being infected. And therefore, it puts most women who are pregnant now are extremely anxious as to, first of all, when I go to the hospital, will I actually contract the disease? Will my baby contract the disease? All those uncertainties. And then you get to a place where it's you and a partner, it's the first baby, both of you are novices. And literally, it's the blind leading the blind. And sometimes the baby is left there and both people would cry. And I just hope that my colleagues and men in general would then get to understand and try to help as much as they can. And this is practical help. And if they can be allowed after they've delivered, because what is even difficult now, they can't even go into the labor ward when she delivers. They only come in and fetch them with the baby. So it's a very difficult time during this time, as where we are likely to see quite a spike in women with postnatal depression.
I don't know, doctor, if you've encountered this specifically during this time where women are not wanting to go into hospital because of the threat of COVID-19 for themselves as well as their newborn. But are you getting requests from more and more couples wanting perhaps to have a home birth?
Well, those have come quite often. And the challenge with that is that it's still safer to deliver in hospital than to deliver at home. You know, the hospitals now, the bed space is reduced. So if you labor at home without support, without professional help, and there's a complication, you are more likely to have problems than when you are in the hospital. Now, the hospitals obviously have developed protocols themselves, both public and private. And the NICD and the Department of Health has also put out protocols on how pregnant women should be managed during this time. The same social distancing that we talk about outside, the way the bassinets are spaced in the nursery to protect the little ones. And basically, I think it's not to an extent whereby women are encouraged that before they go and deliver, they should test just to make sure that after they've delivered the baby, it's known that they are negative, then they can be given the baby to bond with, breastfeed, and all of that. You can imagine if it's unknown what your status is, or you're COVID positive, you give birth to a child, you can't breastfeed because that's close contact, which may be actually something that may harm the baby themselves. So all those anxieties combined, even for somebody who was just going to have postpartum blues, that can push into a depression.
Well, thank you so much, Doc, for your insight and advice this evening. Certainly advice that is much needed during this time of COVID-19, especially for those who are pregnant. Thank you, Doc. That's a gynecologist there, Dr. Meshack Mbokota.